can go to my main software.
Yeah.
Okay. Do you want me to just say that welcome to Medico's community?
No, in a sense, actually, that introductory part, you need to go through that live sessions which has already happened in
Okay.
our.
Okay.
For now, you proceed. We need to check with the slag and all.
So I'll just read out the same PPT out, sir.
Yes, yes, yes.
Okay.
Wait for a minute. Wait for a minute.
Sure.
Let Sagar permit actually.
Sure.
Yeah, ma'am. You can continue.
Go ahead. Okay. So a 15-year-old female on the USG pelvis shows a uterine abnormality with differential diagnosis of bicornuate or septate uterus. An MRI of the pelvis is requested for further assessment. Which of the following findings on MRI is suggestive of bicornuate uterus? Option A is fundal concavity of less than 1 centimeters. B is 2 uterine cavities. C is thin fibrous low intensity septum separating the uterine cavities. And D is convex external fundal contour. E is intercornual distance of more than 4 centimeters. Sir, is that fine? I won't be able to explain anything on these slides. Do I keep reading?
Yeah, ma'am, you can read this, ma'am. You can read this.
A 23-year-old woman with large bilateral low density renal lesions on the CT, a large posterior fossa brain tumor. Review of the old notes reveals that she has had several visits to the ophthalmology department and the condition that she most likely to be suffering from is, choose one of the images. A, whether it's tuberous sclerosis. B, whether it's von Hippel-Lindau syndrome. C, whether it is germinoma. Or D, whether it's pilocytic astrocytoma.
Just go on reading those questions.
Yeah. Question number 18. Rat tail appearance is seen in option A, achalasia cardia. Option B, feline esophagus. Option C, carcinoma esophagus. Or option D is hiatus hernia. 19th question. 18 months old female with increasing incoordination and developmental regression. T2 shows confluent increased SI within periventricular white matter and centrum semi-ovale with radiating linear decrease in the SI, giving a trigroid pattern. Sparring of the subcortical U fibers is also noted. So most likely diagnosis is A, whether it's Alexander disease. B, metachromatic leukodystrophy. C, adrenoleukodystrophy. Or D, whether it's Canavan disease. Identify the lesion on the X-ray. A, osteochondroma. B, chondroblastoma. C, osteoid osteoma. Or D, osteosarcoma. Question 21. A 34-year-old man with a history of ulcerative colitis presents with abdominal pain and copious diarrhea. His X-ray shows dilatation of the transverse colon. Which of the following is the most consistent with the finding of toxic megacolon? Select only one answer. Option A is loss of hostration. Option B, dilatation to 6 centimeters. Option C, anemia. Option D, rectal lesion palpable on DRE. And option E, previous sigmoid volvulus. Question 22. A 2-week-old baby born at 29 weeks develops abdominal distension and raised inflammatory markers. The neonatal consultant suspects he may have necrotizing enterocolitis. Which of the following is not associated with necrotizing enterocolitis? A. Biliary atresia. B. Prematurity. C. Low birth weight. D. Congenital heart disease. And E. Hirschsprung disease. Question 23. A 55-year-old man with an abdominal pain and idiopathic pancreatitis. What is the most likely diagnosis? Option A, annular pancreas. Option B, chronic pancreatitis. Option C, pancreatic divisum. Or option D, pancreatic pseudocyst. Question 25. A 42-year-old man with known tuberculosis presents with blood in the urine and right loin pain. CT urogram performed out of hours showed calycial horns and a signet ring appearance on excretory phase study. Most likely cause. What is the most likely diagnosis in this condition? Option A, acute pyelonephritis. Option B, acute tubular necrosis. Option C, renal papillary necrosis. Or option D, renal tuberculosis. You have different postcards as a mnemonic. P for pyelonephritis, followed by obstruction, sickle cell disease, tuberculosis, cirrhosis, analgesic abuse, renal vein thrombosis, diabetes mellitus, systemic vasculitis. Thank you. So do I keep reading it again?
Sagar, are you there?
Yeah, yes, sir, I am there.
I hope we can't entirely judge.
Yeah, but for this short time, I can say like it's fine.
It's not lagging for the time being. Yeah.
No, it's not lagging.
Yeah. So the thing is, Dr. Chris, what we do now, tomorrow you prepare entirely, you will be preparing your particular
Yes, sir.
PPT so
Yeah.
that you can go through that explanation also.
Yes.
Hello.
Yes. So,
Yes, sir.
so you can proceed, Sagar. You can proceed with that pen tab.
No, ma'am.
If she has any doubt,
Yeah.
you can clear it.
So, ma'am, do you have any particular doubt related to pen tab or anything?
I had one doubt, please. So these are my pen tab settings.
Okay.
What do I select for the rotation? Do I just leave it at 0?
Rotation in the sense, ma'am?
So can you see the screen here?
Yeah,
Yes.
I can see.
Yeah, it says full area, customizable, proportion, and then below it is rotation. So 0 degrees, 90 degrees, 180 degrees.
Mm-hmm.
Does that make a difference?
No, ma'am.
So I'll leave it at 0 degrees.
Yeah.
And
No, in the sense is that pen tab actually works only in the specific area. Every area in the pen tab doesn't operate actually.
Okay.
In the sense, there is a restricted area where you can write.
Okay, sir. So I just
Like
wanted to know if
entire pen tab screen, it will.
Yeah. Whether these settings are okay, and I'll just get
Yes,
used to it.
entire pen tab screen you will not be able.
Okay.
Yeah, this particular setting, Sagar, it is okay, right?
Yeah,
Set
yes,
for
sir.
full
It's
screen.
okay.
Set for full screen.
Full. Yeah.
And ma'am, you can save it from the left hand
Set for
side.
full screen. Yes.
No, ma'am, you can save it from the left
No.
hand side on that black. Yeah, that.
Okay. And this pen tab settings also okay.
Yeah, give it full.
Also are fine. Yeah.
Yeah. Okay.
In the sense, what you wanted to do is for your better practice, for your better writing standard, you need to practice with this pen tab.
Yes, sir. So today when I actually make the presentation all on this new app, I'll just use the pen tab.
Sagar, now this one there is a bit lag.
No, sir, it's fine from my end.
Okay. So the thing is, Dr. Chris, what you wanted to do is you need to practice with the pen tab for your this one. While you write on the screen on your PPT, etc., you need to practice with that pen tab.
Okay.
It is not something like what you write in the books and all.
Yeah.
Like something we need to get used to that particular pen tab actually.
Yes.
Better you write and check for a few words like anesthesia, etc. That one, what it is there.
Yes.
Diagnosis, bicornate uterus, septate uterus, etc. You write and check whether we have used to that or not.
Okay, yeah. So there's something to do with the settings. I'm not able to. I'll figure it out. Like I'm trying to write option, but I'm not able to do the curve movements.
So, ma'am,
is it something to do with this degree of rotation?
No, ma'am.
No. Okay.
No, ma'am. Don't do anything with this.
Okay.
Yeah.
Which icon?
Click on that pen icon.
Pen, yeah.
Pen. Yeah. And ma'am, select the first one.
Okay.
Yeah. And try to write once.
It's a little difficult, but
so ma'am, actually the thing is that now you need to practice a bit more with this.
No, but actually, Sagar, you could see there she has written anesthesia previously, but now she is not able to write. In the top end, can you see there?
Yeah, I can see.
Yeah, but now she is not able to write. Is it because of settings or is it because she needs to get used to that?
I feel like there is some lag.
Actually, the settings are, yeah.
When I'm trying to
lag
write
with the computer.
Yeah. No, try with some small words. Write something like fundal or something uterine or something like that.
So there is some lag, and when I'm trying to spell out the letters, they're not coming out properly. And I use my Apple Pen like on daily basis, so I'm okay with digital pens. That's why I wanted like to check if the settings with the pen are okay. Like, do I need to add any angles to or the degree of rotation?
No, but the thing is,
no, it's fine with the settings.
With the same settings.
Like with the 0 degree.
Yeah.
Yeah, okay.
The thing is, what I feel is, it is a bit difficult to get used to it in one single day.
Yeah.
Like what you need to do now, in your presentation PPT, you need to add more and more descriptions.
Yeah.
As you are not used to this particular pen tab, you need to add more and more description, and better you avoid writing. Avoid writing for this particular session. Better you use for what I call for taking that particular right marks, and for rounding up, something like that you use. And better you use for writing purpose. In the sense, better you avoid, because you are not so used for the time being.
Yes.
Yeah. So your work will be double.
Yes, I'll do it, so no worries.
Yeah. So Sagar, the thing is, we need to check with the introductory part, and we need to check with the lag once again by tomorrow. And Dr. Chris, I wanted you to submit your particular short video for the live session, and I wanted you, and I wanted you to present by tomorrow evening with the what I call ready with that introductory part.
Yeah, yes, sir.
You need to go through that particular Medicos Community YouTube live session, and you go through the different faculties who have taught previously.
Okay, sir.
And you can frame it in your own words.
Okay,
and when you present it in front of us, I will go through that. And if any modification needs, if it needs to be done, I will be guiding you. Okay.
Okay, okay, sir.
So the thing is, anything more we left, Sagar? Technical aspects?
No, no.
Okay. So you present the PPT, because we haven't entirely checked with this what you call connections and all, because for every faculties we check it for nearly 15 to 20 minutes with their PPTs. So we'll finalize this particular this one what you call area of lagging and the network connections and the generation of your MacBook Air, etc. by tomorrow evening.
Okay, sir.
But for that you need to submit the PPT. That's it. So that you can explain that particular your subject. With these subjects, I can understand. When we do the specializations, some grips will not be there. I can understand that.
Okay.
Yeah. Go ahead with your PPT and you continue the process, so that we'll be ending the meeting for today, I feel, sir. Am I correct?
Sir, do I submit it as a PPT format, or do I submit it as a PDF format when I complete my presentation?
See, actually, we give two options to every faculties. Like, we will confirm whether our faculty is comfortable with the PPT or whether our faculty is comfortable with the PDF.
Okay.
Like, when you submit with the PPT, if you're comfortable with the PPT, then we don't have any kind of issues with that. Okay. But when you submit with the PPT and when you're practicing in the training session, if you feel any discomfort with your PPT, then only we will ask you to convert into the PDF. So with PDF, yes.
Sorry, sir. So because the problem is I'll be using the Notability app. So Notability app is only compatible with other Mac devices. So I'll have to export out my file as a PDF and send it to you.
Okay, ma'am. No issues. You can send us the PDF too.
Okay, I'll try and finish and send it by tomorrow evening.
Sagar, in the sense we'll be sending it in the PDF, na? So we'll be converting it into the PPT, you mean?
Yeah.
Okay, if we convert it into
I will be also sending the PDF file to her.
No. My question is, when we convert it into PPT, whether it will be compatible with her device actually?
Sir, I will send the PDF only, na, to her.
Acha. So that she'll be doing in PDF only.
Yeah.
Okay, there is no question of PPT with this particular session.
Yeah.
Okay. Then fine. No issues. So, Dr. Priscilla, you will be doing with your PDF only, and there is no question of the PPT.
Yes.
So the thing is, we'll be closing the meeting, and Sagar, you wait for a minute, and Dr. Chris, you can leave the meeting.
Okay.
And you be prepared for all these things what I have told. Okay.
Yes, sir.
Okay, thank you.
Okay.
Sagar, you please stay over the line. Okay. Thank you.
Okay, thank you, sir. I'll send it by tomorrow. Thank you.
Okay.
विपुल हो गया